Dennis, thank you for joining me. You menace, Dennis the Menace. So what do you think? Do you think the army are capable to tackle the vacancies that are left by strikers? And actually, should we be expecting them to do that?
No, I'm a great fan of the army. I think they are superb professionals, and probably it's the last bit of British public service, the British state, that functions according to honour, duty and responsibility. So I understand if there's some demand being put on them. I don't actually think it'll make much difference because the people, I think, are with the nurses. We've had the accusations their pay rise could be inflationary, but Sir John Geeve, the Deputy Governor of the Bank of England, said quite clearly, look, the National Health Service doesn't charge anything. It doesn't put up prices. So by definition, you can't have wage inflation in it. The people who are putting up prices are our supermarkets and lots of other people who are quietly racketeering to make money out of this. My worry about the army is it's been cut by successive Conservative prime ministers to the lowest level since the beginning of the 18th century. We're half the size of the French army. They do a magnificent job. We get a great bang for the buck, but they're trained to kill, for heaven's sake. And turning them into nice, cuddly nurses, I'm just not sure it's really going to work or really help. I'm very disappointed in Rishi Sunak. I didn't think he was going to be such a gimmick merchant as Boris Johnson and Liz Truss. But with this little stunt, he's back into silly gimmicks instead of sitting down, talking with the nurses, cutting a deal in the middle and stopping any more fear and worry for the British people.
But what do you think, though, briefly, Dennis, of the idea that, first of all, the army are going to... somebody has to do it, so we're going to get the army in. But then there's the fact that the army are public sector workers who cannot strike, and they're actually getting paid a lot less than public sector workers who can strike, and they're covering for these people. It just doesn't sit with me. What's your thought on that?
We're all uncomfortable with it, and I'm sure the army personnel, especially the lower ranks, who are perhaps hoping to get away for a bit of a Christmas with families in the coming days, will be disappointed. They'll do their duty, and we should admire them for that. But we should be very, very careful. I mean, the highest commanding ranking officer, the head of the entire military in Britain, Admiral Rankin, said today he doesn't want to get the army involved. Obviously, you'll get a few right-wing officers who'll pop up and sort of write letters to the Daily Telegraph saying, no, break the strike, strikes are terrible. But we're with our nurses. I mean, I don't think they're being sent to drive trains or to do the portering and other work in stations that, of course, the RMT and Mr. Lynch's members are out doing. It's an easy target to drive some ambulances around, maximum publicity, it's gimmick time. And frankly, I just wish our Prime Minister... Has he ever used the NHS, Dana? Do you know? I mean, you follow...
Of course I use the NHS. I don't think Rishi Sunak, though, does, because remember, he's almost a billionaire. Dennis, stay right there, because I'm also joined by former head of counter-terrorism